Hey everyone, so in the last lecture we covered disc displacement with reduction. Now in this lecture we'll be continuing this concept forward and understand that how it leads to eventually disc displacement without reduction. Okay, so we established last time that in disc displacement with reduction the disc is positioned anteriorly and medially. So when this repositioning happens over a chronic period of time, it leads to elongation of the discal ligaments and also the retrodiscal lamina. So as this happens, the lateral pterygoid muscle, keeps on pulling the disc anteriorly and medially more and more. So eventually it will lead to thinning of the posterior border of the disc. So ultimately the disc will lose its self-positioning feature over the condyle and it will keep on migrating forward till eventually the disc is forced through the discal space and it will collapse the joint space behind it. So this is now called total displacement of the disc. Okay, so now even after total displacement of the disc has happened, the patient can still resolve this locking on its own and without any assistant. So till this stage, it is called disc displacement with intermittent locking. Now, when this also progresses over time, the locking episodes, they become more and more frequent, more and more chronic. The discal ligaments, they disintegrate more till eventually the patient is unable to return the disc to its normal position. And now it is called disc displacement without reduction. Okay, so now in disc displacement without reduction, the mouth cannot be opened maximally. It does not allow full translation of the condyle. The maximum mouth opening will only be between 25 to 30 mm. And on opening, the jaw will be deflected to the affected side. Now, this condition is also known as a closed lock. So, this condition now is called disc displacement without reduction. So, I hope now you understand both the conditions properly, disc displacement with reduction and how it leads to disc displacement without reduction. And in the next lecture, we'll cover the management part of this.